Welcome to Navigating Life After 40, the podcast that's all about helping women navigate this exciting and sometimes challenging phase of life. I'm your host, Ronnie J, and I'll be here sharing some of my own personal experiences, chatting with experts and a few friends, and also providing some practical advice and support to help you live your best life after 40. Let's get started. Welcome back, everyone, to another episode of Navigating Life After 40. I am here with a special guest, Teneika Gravely. How are you, Tenieka? How are you doing today? Thank you for being here on the show.
Thank you. I'm doing well. I'm excited to be here. I love what you're doing with your platform. I think it's very much needed for women over the age of 40 because there is nothing else out there like this that I've seen so far. So I really appreciate the awareness that you're bringing.
Thank you. Thank you. I'm so excited to be able to provide this space and for so many women, because of course I have these conversations about things that we don't talk about. Our parents didn't talk to us
Mhm.
about it, our moms, aunties, grandmothers. I always like to say we may have seen them change in some way, like the attitude change or they're fanning themselves, which is going to lead us into today's discussion, but they never really had the conversations with us. It could be because their parents did not have those conversations with them. And so I want to just create these spaces where women can be educated and can have
Right.
community and space to share their experiences and learn. So, yeah, thank you so much for those kind words. I'd love to kick us off so we can learn a little bit more about you and your background. And so, as a board certified family nurse practitioner with a specialization in integrative and functional medicine, what inspired you to focus specifically on hormone balance and its impact during menopause and perimenopause?
Sure. So I had gone through my own struggles at a very early age with hormone imbalance. And at the time, I had no idea what was going on with me. I didn't even know the questions to ask or the symptoms to report because, as you said, no one had these discussions with us. I thought, oh, this must be what everyone's going through. Um, and then it got pretty bad for me mid 20s, early 30s, to where I was requiring blood transfusions multiple times, went for 2 procedures that didn't help me at all. And then I met a GYN who said, you know what? Let's just take it out. Let's just give you a hysterectomy and you'll be done.
Mhm.
I said, okay, great. Before I went for the hysterectomy, I was placed on oral birth control pills that didn't help me at all. Had the hysterectomy and maybe a week after ended up with blood clot in my lungs. So the birth control pill caused the blood clot and it was just downhill from there. It was a struggle. And as I went on, I still honestly had no idea what questions to ask. I still had no idea that it was all tied into hormones. So as I'm working through my profession, I noticed there were so many women with the same complaint. So many women saying that they were being ignored. So many women saying that nothing was being done. So many women that were just being prescribed medications for antidepressants, anti-anxiety medications. And you're like, I am not depressed or anxious, but something's wrong. So then I just made the conscious decision of I am going to study women's health, learn everything I can because I don't want other women to go through the struggles that I went through. And here I am.
So, thank you for sharing your journey. And I always get saddened when I hear stories of women who did not get the help they needed. Someone who also has shared my experiences and also continuing to share my experiences and trying to advocate for myself. And it's always here, just take this or just try this or we don't want to do this part yet. And I'm just like, but what you're giving me isn't helping. And
Exactly.
yeah, and I remember my mom going through a similar situation as well, where she had to have a hysterectomy. And I never understood why until I got older and I started asking questions. When I started going through changes in my body, and I was like, why did you have a hysterectomy? And so when she shared that with me, I said, so you didn't ask these questions, you didn't share these things. And she also shared that she did, but doctors felt like this is the best approach for her at the time. And it does seem like women were not heard, but it's particularly Black women. It seems like we're
Mhm.
really not taken serious when we're sharing our concerns. And so thank you for sharing your story. And then also just for being aware that there are so many other women out here who are experiencing the same thing, and you're doing this work to make sure that women do not have to go through those same challenges. And
Yes.
so thank you for that. All right. Let's hop into the discussion.
Let's do it.
This very important topic. And for those of you who are listening, I have shared that we are doing this in segments and different, we're breaking this down. So we've done part one, and part one will be coming out soon. And this is part two, where we're going to go into the medical aspects and all of those things about menopause, because we really wanted to see the breakdown and have so
Mhm.
that you all can have all of the education that you need on all fronts. And so it's not just these things apply, but it's also some of us are still working. How do we advocate for ourselves at work? How do we advocate for ourselves when we go to the doctor? And I have been, I don't know why, but I've been so excited to discuss this subject,
Mhm.
especially this area. So we know that typically they say perimenopause begins at the age of 40, but we know that it can also start earlier, is what we're learning too. This is also seen as like a transitional phase leading up to menopause, which we know once you get to that point and you don't have a period for 12 months or so, from my understanding, that now you're considered in menopause.
Mhm.
Can you explain the difference between perimenopause and menopause and how they just differ a little bit outside of the 12 months of no cycle?
Sure. So perimenopause, like you said, usually textbook around the age of 40. But we're finding out that people or women are reporting that these symptoms can start as early as mid 30s. And that's
Hmm.
due to a lot of different factors, mostly endocrine disruptors, meaning things that are environmental, that we're exposed to, such as different ingredients that are in our skin products, makeup, shampoo, foods that we eat. All these things can disrupt the endocrine system and contribute to perimenopause starting at an early age. What happens is your progesterone drops first. And with your progesterone drop, your estrogen becomes erratic. If you have high estrogen, you'll start to notice that there are irregular periods that are heavy, or you can have a period for a few days, the period goes away, and then maybe 2 weeks later, within that same month, it comes back. You can experience more painful periods, sleep disturbances, irritability, mood swings. And then as you continue to go on mid 40s, you start to experience more symptoms leading to menopause, which typically starts around the age of 50, or the textbook is 51. And that is considered you going a full 12 months without a menstrual cycle. If you get to that 11th month and 28th day and it comes, guess what? You're starting all over again.
Right. Oh,
So it
wow.
has to be 12 consecutive months without a cycle before you're considered to be in full menopause. Unfortunately, some women experience maybe one or two symptoms, and then you have other women who experiences almost, or they feel like they experience almost all the symptoms that's related. It definitely varies from woman to woman. There's a lot of contributing factors with that as well. But typically, perimenopause, early 40s, menopause after 12 consecutive months without a cycle, and then you're considered full menopause.
Thank you for sharing that. I know I have experienced all of those and continue and continue to have those challenges. And there are also things that I go back and forth with when I go to the doctor. I had one doctor tell me that you're too young to be going through that. And I was like, Sir, like, I didn't go to school for this, but I know these are the symptoms that I'm experiencing, and these things equate to perimenopause. And he just did not believe me. And I'm
Mhm.
sure other women share that same stories. Like, I'm going and they're not listening and they typically rush. And I know I'm going to get to this point because this is one of those things that really drive me crazy is the medication piece. And I don't want to go too far ahead, but I know I'm going to come to that because it frustrates me a little bit. But I do want to ask this question. It is a listener question. And so we will throw listener questions out throughout this episode unless Tenieka shares the answer to that, then I won't focus on it. But for those of you who have asked questions, I'll throw these out if those things have not come up. What are some non-typical symptoms that one might experience if they're not having hot flashes or night sweats, which are that we hear that we hear the most from women?
Sure. So some of the atypical symptoms can be joint pain, such as like frozen shoulder, stiff joint. I myself experienced frozen shoulder, and the orthopedic surgeon that I went to had no idea what was causing it. He actually was throwing things out, obesity, diet. And I said, no, I don't think any of those are it. But he couldn't put his finger on it. And I knew something was going on. But ironically enough, when my hormones became balanced, I haven't had any issues with my shoulder since. Some of the other things that women complain of is dry, itchy skin, or flaky skin that doesn't change no matter what the season is. It usually often gets mistaken for eczema or psoriasis, but it's actually related to hormonal imbalances. Some of the other issues is digestive symptoms, the bloating, getting full fast, not able to lose weight or gaining weight that's been associated with hormone imbalance. And ironically, some women report feelings of electric shock throughout their system or throughout their body. And it often gets mistaken for something called neuropathy, but it can actually be due to hormone.
Wow. I've heard
Mhm.
of frozen shoulder recently, but I've never equated like the other things that you mentioned to being a part of perimenopause. I never knew that. That's great information to know. Wow. This just has me like, okay, thinking about you remember that time that you had this issue and you went to the dermatologist and they told you it was this, it was possibly this. And so that's where my mind is going now because it does seem like you get these random diagnoses because
Mhm.
a lot of doctors are not really well versed in this area. And
Yeah.
I'm starting to hear more female doctors focus on it, but it's not that many. But it would be nice if there was more research done on women going through menopause and perimenopause, and also doctors really taking the time to understand more about this. Because we're coming and we're sharing these things, and instead of telling us exactly what it is, it's like we're getting a pill thrown at us, which leads me into this next part of the discussion about treatment options because they're so quick to just say, hey, here's a antidepressant. I know I had my doctor threw that at me and I was like, I'm not going to take that. And we had to do a negotiation for 30 days. I said, listen, I feel it, but it's going to sit on the counter for 30 days. If I don't take it, I'm throw it in the trash. Like, I am not taking this. I was really hesitant about taking it. And then one day I was just so anxious. This anxiety would not go away.
Mhm.
And I did have to take one of those. And I never experienced anxiety at all in my life until I started going through perimenopause. But I'm curious to know what tests should women discuss with their healthcare providers when they suspect they are entering perimenopause and menopause? I know this also is also a way of advocating for yourself. Are there any particular tests that you recommend?
Yes. So when most people think of getting tested for perimenopause and menopause, They just really focus solely on your sex hormone, which is your estrogen, progesterone, and testosterone.
Yeah.
However, there's a whole cascade of hormones that should be tested as well because everything works in conjunction with one another. So it's almost like having a old car, putting brand new tires on it, but the car doesn't run. If you're only testing one part and nothing else, what good is that going to do in the end? When you get tested, you should ask automatically for your regular labs that you would get a CBC, a CMP, which is going to test all your blood cell lines with the CBC. The CMP is going to test a lot of your organ functions, your electrolytes, things like that. On top of that, you want to get your FSH and LH. What that does is tell how your brain is sending the signals out to your body, making sure that it's functioning correctly and then making sure that there's no issues with that part. After that, you want to ask for your cortisol, which is I use a 4-point cortisol. It's a saliva test, a test you can take at home. That measures your cortisol from the morning. We want a cortisol spike that wakes you up, you're perky. As the day goes down, we want to see that spike drop so that by nighttime, you're ready for bed, you're relaxed. A lot of times, what happens is that cortisol is just completely flat. And if that happens, everything is going to be thrown off balance. And, you know, you'll be more tired. Nothing else is going to work the way that it's supposed to properly work. So you definitely want to get the cortisol checked. A lot of physicians, if they check the cortisol, is only going to check a morning cortisol, and that's just not good enough. So you want a 4-point cortisol. The other things you want tested is a DHEA, um, and that's pretty much it. But it's a pretty comprehensive testing. Your thyroid also, I forgot to mention that your thyroid is very important. And you want a full thyroid panel. Most doctors will just check a TSH. Some will take an extra step and check a T4. There's a whole other slew of thyroid that you definitely want to include so that we can get the full picture of not only how the thyroid gland is functioning, but to make sure that your cells are taking in that thyroid so that it can function properly on that level as well.
I love that. And I love that you do this comprehensive testing to fully understand what is going on with your patients. Because as we mentioned, a lot of doctors don't do that. You mentioned the thyroid. I know I have challenges with my thyroid, and you're right. They will check that TSH and, oh, you're good. Everything's normal. And you're going to see you on your way. Keep taking your meds as prescribed. But you're still feeling all of these other symptoms and these other things
Mhm.
that are going on. And the approach that you're taking, I think is so important for women to know because I never would have guessed, like, hey, there needs to be these other tests done. But I love that you broke that down and you're really doing this comprehensive makeup to have a full picture
Mhm.
of this individual and what could potentially be going on here. What would you say for those who are listening and they are trying to advocate for these things for themselves, but their doctors are like, oh, you don't really need that. I've been there, done that. I've had a doctor fuss at me just for asking for a certain lab to be done. And he really called me on the phone and chewed me out. And so, what would you say for those listeners who are trying to advocate for themselves to have more testing done, but the doctors are not really being open?
One thing I will say, most providers don't know the appropriate times to test. And that's one of the reasons why they think testing is not necessary. What you want to do is
Mhm.
have the discussion with your provider to let them know that you should be taking the test around day 21 of your cycle. Most women have a 28-day cycle. Some providers do go from day 19 to 21. So, how you count those days is the first day of your period as day one. You want to test day 19 through day 21. If you have irregular cycles, there are specialty tests that you can test throughout the month, or you can just test 7 days before your cycles. Definitely explain that part to them because a lot of them
Mhm.
don't know that. And they'll just send you for a random blood test. And those may not be true levels because they weren't tested at the appropriate. So that's one of the reasons why a lot of providers will say the test won't mean anything. It won't tell us anything. It won't give us the information. It's because it's not being tested the appropriate time. Definitely remember days 19 through 21 of a 28-day cycle. If you're irregular, just try to do it 7 days before, or you can use a specialty home test where you can test throughout the month. Another thing that I tell women, you know how when you're around a lot of women, you sync up together? So
Yes.
if you're irregular or if you've had a hysterectomy and you're not really sure where you are in your cycle, go by one of the other females that you're living with. Because usually we sync up together and you can use that as a little tool to have your testing done.
That is so helpful, and you're right, we do sync up together, especially when you work.
I know.
I have never understood that. It's okay, and everybody's at the same time, and all these
Yeah.
attitudes are floating around the office. Never understood that, but that is a great tip. If you can't remember, and if you're not tracking yours in an app or on a calendar, get with someone in the office that you've had those conversations with. Girl, yeah, it's my time and the money. You like, yeah, me too. You can go to that person and ask them, can you tell me when was our last cycle? So you can do
Mhm.
some counting. So I love that. You talked a little bit about hormone therapy. And so I'm curious to know about the different types of therapy that are out there. What are the potential risks? I know I've been seeing some things where they say it's linked to breast cancer, and then other doctors saying it's not linked to
Mhm.
breast cancer or cardiovascular disease. Can you talk a little bit more about that?
Sure. So, what initially had everyone in an uproar was a study that was done by the Women's Health Initiative. That came in this study, it came out that hormone replacement therapy caused breast cancer, and then they completely stopped it across the board. No one gets hormone therapy replacement or hormone
Hmm.
replacement therapy. What they failed to also notify the public is the women that they were testing had tons of comorbidities. They were advanced in age, and the hormone replacement therapy that they were using was synthetic. The estrogen that they were using actually was made from horse urine, and there's chemicals and everything that's involved. They weren't using bioidentical hormone replacement therapy. So the difference is with bioidentical hormone replacement therapy, or you hear it called BHRT,
Hmm.
that is made to have the same molecular structure as the hormones that we have. So our body is able to accept it and use it. There's virtually less risk than what they were reporting with the Women's Health Initiative. There have been tons of benefit with using BHRT as far as cardiovascular benefits with estrogen. There are cognitive benefits. It helps to actually, or it's been shown to help fight against dementia, um, Alzheimer's, things like that. Even a lot of women, when they've been starting to go through these phases of perimenopause, the first thing they'll say is, oh my gosh, am I getting dementia because I'm having a hard time remembering things? They're searching through the house looking for their keys, and their keys are in their hand the whole time. Or you want to start a conversation with someone, and what you want to say is at the tip of your tongue, but you can't get the words out. And they're like, that's the first thing they say is, think I have dementia. And it's just because their hormones aren't. They've actually debunked a lot of things that was in that study. But as we know, bad news travels faster than good news. There's still a lot of misinformation that's being spread. There are still a lot of providers that don't necessarily, it's been embedded in them not to use. hormone replacement therapy. So they just stay away from it completely. There are some providers who still choose to use birth control pills for symptoms instead of turning to BHRT. There are some providers that are using depression medication to handle hot flashes and menopause symptoms. And these are things that just cannot be avoided altogether if they get the proper training and read up on the latest research. They'll clearly be able to see that there are tons of benefits with BHRT.
Thank you for sharing that. When you were talking, it just took my mind because I'm like, I remember the first time and we talked about this at work for a bit. We did because I work in the daytime in a tech industry. And so we talked about this in one of the women's ERG meetings. And we talked about how we felt so stupid. We would be in the meetings, and I remember for myself, I just moved into this new position and I would raise my hand because I had a question or had a thought I wanted to really contribute. And in mid sentence, I would go blank. And it happened so much. And I was just like, am I getting dementia? Because I know I lost my grandmother like a
Yeah.
year prior to it. And I was just like, am I getting dementia? And I was so hard on myself. I thought I was losing my mind. I was trying to go to therapist and I was like, something is wrong. I'm stuck. Something is happening. Can you help me? So it's nice to know that one, you're not alone and that it's not what it is. It's just there are some things that need to be balanced out. And yeah, I'm sure probably plenty of people is listening to this episode are like, yeah, that's me. I'm talking mid-sentence or I'm forgetting things. I forgot something this morning before we started recording this episode. And I was like, I know I put this right here. Where is it? And the whole time it was right there in my face. And so I'm happy to know also that these hormones are helpful because you're right. Bad news travels fast. And whenever I'm seeing some videos like on social media about hormone replacement therapy, I'm seeing in the comments all these people saying, oh, you're going to get cancer. You're going to get cancer. And to hear, okay, there was a study and everybody's going off of this study, to me, it sounded like, hey, they needed to just start over and do another study because what they were doing obviously was not effective. And as you mentioned, they used older women and they used horse urine, which shocked me. My face, what? But
Yeah, pregnant horse urine.
really? Oh my God. So it's almost like they should have went back to the table. Let's go back and do this over, start from scratch, do another research on this, and let's use a different demographic, a younger demographic of women, so that we can maybe get the full details and use some treatment options that made sense other than pregnant horse urine. That just bothers me. That just bothers me to hear that. So thank you for sharing.
You really don't research much for women as they do for men, unfortunately.
Yes.
So that definitely has to change.
Yes, I agree. 100%. I agree with you on that. It has to change. There should be more research out there done on us. So we can have a whole different conversation. They want to control our bodies, but you don't want to do the research to help our bodies.
Exactly.
Okay. I have another listener question here. Are there supplements that can help manage hormones rather than the prescription medications that doctors and also NPs like yourself typically prescribe?
Yes, there are a lot of things that you can do actually, even aside from supplements. That is why I think it's very important for you to get a comprehensive exam because as I stated before, during the examination, it's important to make sure you list every symptom that you're having,
Mhm.
get the necessary labs that's needed. Like I said, checking organ function, cell lines, nutrients, electrolytes, because you want to make sure that everything is optimized before you turn to supplements or even BHRT. And other ways to do that would just be diet, lifestyle changes, eating properly, things of that nature. And then I would say turn to supplements to help optimize things. Vitamin D is a big thing, vitamin B,
Mhm.
iron deficiency anemia. Those are a lot of diagnoses that I see with my patients. I always say turn to food first and then
Mhm.
supplement, and then if needed, medication.
I like that. And I'm glad that you brought up diet because that was the direction I wanted to really go into next is really the importance of how diet and exercise can be in helping to manage these symptoms that are being experienced by women. You mentioned the relationship between food and nutrition. Are there any tips that you can recommend for women to like maybe start slowly incorporating more of in their diet or decreasing less, taking some things out of their diet so that they can help to control these symptoms a little bit better?
Yeah. If I can give you three things: eliminate sugar, alcohol, and foods that your body may be sensitive to. So when you're eating things that you have a sensitivity to, it increases inflammation. Inflammation, that can be a whole nother podcast. And that leads to a whole slew of other things. So I would definitely say, eliminate sugar from the diet, alcohol altogether, and then find out what foods you're sensitive to. If you don't know what foods you're sensitive to, there are food sensitivity tests that you can take, which ironically, when I did mine, I had a sensitivity to everything that I eat for breakfast, usually in the morning. Granola. Um, there were, dairy, which I had granola, yogurt, and strawberries. That was like my thing. And I was having these symptoms. They called it urticaria, which means just like this, it was this internal itching. They couldn't explain
Mhm.
it. They didn't know why. So they said, oh, it's just idiopathic urticaria. And I said, that's not giving me an answer. So I did this food sensitivity test, took out these foods, no itching since then. So I also did a gut test. Like I did other things and I worked on the things that I needed to work on for my gut, but I went through about 4 months being on steroid therapy, topical cream, and all along it was food sensitivity. So those are the top three things that I would say work on with your diet. Definitely hydration is
Mhm.
huge. Staying hydrated is probably one of the most important things that you can do. So if you're just starting out, try to say, I'm going to have a lot of people they're like, oh, I got to drink water.
Mhm.
I don't like the taste. And I say, okay, just add fruit, add lemons to it, add blueberries, do whatever you
Mhm.
need to do to spice it up. Don't get all crazy with all the additives, squirt drinks and things like that. But try some fresh fruit in there and let that sit for a while. Make it ice cold, whatever you need to do to get it down. Just start off with staying hydrated and then slowly try to incorporate other things like decreasing sugar or definitely try to eliminate the artificial sugar. And then alcohol, try to stay away altogether and just recognizing what your food sensitivities are. If you don't do a food sensitivity test, a lot of things that people are commonly sensitive to are gluten, dairy, things like that. So try to eliminate that just for a few weeks to see how you feel. And then I promise you'll notice a
Yeah.
difference.
And it's things that we hear about a lot. Sugar and the processed stuff, and you mentioned alcohol, and I'm like, I know somebody's listening is probably, "Hold on now. Hold on. I gotta have my glass of wine. What about when I go out for dinner?" So what do you say to those women who listen, "That's gonna be a hard no. I don't know if I can do that." What do you say for those women?
I say we're all human. It's not realistic to expect someone to just completely cut something over. My goal is to get you to see how it feels if you don't have it. Because usually, if you can get to that point, you'll say, you know what? Not really worth it. I'm going to stay away from it. I like the way I feel without it better. The other thing that I noticed too is it becomes a vicious cycle. If you're tired, You're exhausted. You have work life, you have home life, everything just
Mhm.
pouring in on you. So what do? You turn to comfort food, right? After the
Mhm.
comfort food, you want a glass of wine, you try to go to bed. Now, either you're having trouble falling asleep or you fall asleep and you wake up and you have trouble getting back to sleep. Then it's this vicious cycle. Now you're even more tired because your sleep was interrupted. Then what do? I'm going to eat something that makes me feel better. After you
Yeah.
eat something that makes you feel better, you're going to go out with your girlfriends, have more wine. And then you're going to just keep going and going in this vicious cycle. So I just try to say, you know what? Instead of comfort food, try just one meal, one home cooked meal instead of fast food. See how you feel after that one home cooked meal. Something that's high in protein, good fat, lower carb or good carbs. And
Mhm.
just see how you feel after that. Try to go if someone's having a glass of wine every night, because you do have those times where you're like, listen, I've had a rough one. So try to stay away from the wine just for a night, just to see how you sleep that night. And then I just
Yeah.
try to just baby steps, one day at a time.
So take just a small little step. You don't have to, for those of you like, oh, okay. You don't have to cut it all out completely. I know for me, I'm not, a lot of people are always shocked when I say I don't drink alcohol. They're like, really? And I don't, because it seems like it has so much sugar in it and it
Mhm.
would just make me feel bloated. And I'm like, I don't like that. But it does sound like just taking those small little bitty steps to start eliminating things and then just seeing how you feel. And then over time, if you notice, hey, I'm feeling better, I'm able to get more rest, I have more energy, I'm not feeling these other type of ways, then start now decrease a little bit more until you get to the
Right.
point where you no longer desire to have it. So those are very good points. Very good points. So I know I had to point that out because I know somebody was going to be like, I
Like
am not going to
awesome.
cut out my yes. I'm not gonna cut that one out. I hear you on the sugar, but I'm not gonna do this alcohol. So thank you for sharing those points and really just breaking it down in terms of here's a way for you to start so you don't have to jump all in right now. I have a question for you from another listener, and that is about losing weight. One of the questions was, how do you effectively lose weight when your body is fighting to hold on to every calorie you take in when you're currently in perimenopause?
I get that question a lot. So, what you would want to focus on again is going back to staying hydrated. I have a nutritionist on my team that
Mhm.
helps women out during their perimenopause and menopause phase because, as we know, the older we get, it's harder for our body to let go of those extra pounds, right?
Yeah.
Especially in the midsection where we're walking around again feeling bloated, not feeling like ourselves. I had one patient who always sat down and had a pillow in front of her because she was just so self conscious about the extra weight that she gained. Hydration, proper diet, make sure you're not starving yourself. A lot of women think that, oh, if I don't eat, maybe I'll lose weight. And your body just does the actual opposite. It's going to hold on until every single cliche you take. If you smell a calorie, it's going to hold on to it. So you definitely
Yeah.
want to make sure you're eating throughout the day. I know it's cliche.
Mhm.
Breakfast is the most important meal of the day. So make sure that when you get up in the morning, you're having a glass of water. Some people drink warm water. Some people have their green tea, have a nice wholesome breakfast. And the other important thing would be strength training. As you get older, you want to incorporate more strength training. I do have a lot of patients who are runners and they're like, I'm running 5 miles a day. I'm still not losing weight. And it's because they're not incorporating strength training into their exercise program. So as we get older, we start to lose muscle mass. You want to gain on to keep that muscle mass. Obviously, you're going to have to focus more on that because that'll burn more calories throughout the day. So that's a huge tip. Strength training, proper diet, make sure you get that breakfast in, make sure you get that protein in. and staying hydrated.
Yeah, that's good. Really good tips. As you mentioned, I see a lot of women doing the same, and I've been guilty of this too. Oh, if I don't eat, maybe if I,
Mhm.
intermittent fasting, if I just go another 2 hours, I'll be okay. And I'm working out in strength training and I haven't eaten anything, but I notice when I do eat, I perform better. And I often hear women on social media try to do the same thing. I see them saying, you know what, I'm going to do this. I'm going to do this quick fix. They always want the quick fixes. And when I say you really need to strength train, and because as we get older, we're losing a lot of muscle mass and those type of things. And the first thing that comes up is, I don't want to be big and bulky. And I'm just like, you're not. They think they're going to look like this big muscle man. And I have to convince them that you're not, but you have to give it a try. You cannot keep turning
Mhm.
to the shakes and the pills and those fast things to lose weight because guess what? You always gain it back. And then
That's
you come
right,
back
and
on
when you
social media
back,
again
you
and you're
gain back
like,
more.
you yes, you gain back even more. So why not try something different that can help you sustain this over time? And maybe hearing it from the expert, they'll say, okay, she ain't just talking. Here's an actual expert just telling me to do the same thing. So thank you for those 3 tips that you shared there as well. And I know there is one thing that often comes up for women and that is some vaginal trouble, like low libido and those type of things that come up when women are going through menopause and perimenopause. What are some effective ways to address low libido during menopause?
So, some effective ways to address low libido would be obviously you'll need to have your hormones tested because we need to see what's off balance. That's probably one of the biggest things that you can do. Once we figure out what imbalances you have, we work on optimizing that. Now, usually it can be fixed with estrogen creams, especially if it's low libido, we focus on other things too besides sex hormones, is stress hormones. We want to make sure that you're nice and relaxed. And usually what happens is we get very busy. You're irritable. Your cycles are irregular. Sex is the last thing on your mind. But once we can get that balanced out, usually things tend to calm down and then we can rev that libido back up. Your testosterone is going to play an important factor in that as well. If you're having issues with painful sex or vaginal dryness, we look into things like estrogen cream that we can prescribe you. There's all these other little things. There's one part cream and things that'll get the lubrication going and the feistiness back. So that coupled with
Mhm.
testosterone balance usually does the trick.
I know that is something that I've been seeing women talk about too. And when they bring it up, I'm like, I have no idea, but we're going to have this conversation. But for some women, they experience urinary incontinence. What are some strategies or treatments that are out there that can help women who are going through this right now?
Yeah. So with urinary incontinence, I know every woman has heard this. We all don't necessarily do it. Is
Mhm.
Kegel exercises.
Mhm.
Probably one of the easiest things we can do. You could do it anywhere, at any time, any place. No one knows you're doing it. The funny thing is, though, once you start talking about it, everyone, oh, I'm doing it now. So, but
Mhm.
doing the Kegel exercises can definitely help when you're in the phase perimenopause and menopause. You are at a higher risk of getting urinary incontinence. There's different types. There's stress incontinence, meaning if you laugh or sneeze, you may have some incontinence that way. Some just have urgency where they're trying to make it to the bathroom and can't get there in time. But there are different medications and things like that we can look into that'll give you support through the phase of urinary incontinence. But it's important that you definitely get tested properly. You'll need a urine analysis done to make sure that there's no urinary tract infections or anything like that going on or any bacteria that needs to be
Mhm.
treated. And then from there, like I said, depending on what the underlying root cause is the way that we'll go for treatment.
You've shared so much here today, so much great information. Do you work with patients in several states or in one particular area in case someone is saying, how can I work with Tenieka? How can I connect with her to get the support that I need?
I can be reached at www.tagfamilynp.com. And I also have a creator page that I've just recently created on Instagram called Tag BHRTNP, where I give
Mm,
a lot of helpful tips. I make a couple of videos, some reels that just give information on all things women.
I love that. I love that. Any last minute tips as we wrap up here today? Any last minute tips or advice for the women who are listening to this episode today?
My advice would be just to understand that because symptoms that you are having are common does not necessarily mean that these symptoms are normal. Uh, Don't let anyone tell you that or brush you off and say, you know what? Everyone goes through this. This is just a part of life. This is your lot. You have to deal with it because that's just simply not true.
Yeah.
There are ways to help you. There are ways to mitigate symptoms that you're going through. You're not going through it alone. There's definitely help out there. You just have to find the right provider who's been properly trained to assist you. But there are definitely things out there that can help you through these periods of life with all the symptoms that you're going through. But definitely don't sit back and just deal with it.
For those who are listening, I will definitely drop her new IG page. It'll be in the description as well as the website and those type of things so that you can learn more about Tenieka and the work that she's doing and also be more educated on this. And also know you're not alone. Women, we're out here going through this together. I'm going through it with you. And I know I have shared some of my experience during this episode, but I will say that I love to ask questions. I love to be educated on things. And I will also make sure that I'm following you on Instagram as well so that I can continue to educate myself and then also pass those things along to my listeners and my community as well. So thank you so much for being here today and for sharing
Thank you for
all of this
having
great
me.
insight. You're welcome. You share so much great insight, and I truly appreciate it. All right, everyone, that is it for this episode. I look forward to chatting more with you about this in the Facebook group at Navigating Life After 40 to hear your thoughts. In the meantime, I will see you later. That's a wrap for this episode of Navigating Life After 40. I hope you enjoyed this conversation just as much as I did. If you love what you're hearing, be sure to hit that subscribe button so you never miss an episode. And if you're feeling generous, leave me a review on your favorite podcast platform. This helps me to reach more amazing women like yourself who are trying to navigate this amazing life. Thanks for tuning in. And until next time, keep living your best life.